Hello, I'm Dr. Steve Hotze, founder and CEO of Hotze Health and Wellness Center. My goal is to help you obtain and maintain health and wellness naturally so you enjoy a better quality of life. So the question I'm asked frequently by women is it possible that I could have low thyroid problems that just don't show up on the blood test because my doctor has told me my blood tests are normal? Let me explain. The answer to that is absolutely yes. The best way to determine whether or not an individual has hypothyroidism, and that's low thyroid condition, is to listen to them. To listen to them tell you their symptoms. Classically, individuals that don't have enough thyroid hormone within their cells have a host of symptoms. One, some, or all can appear at the same time. The thyroid gland in the neck produces the thyroid hormones. The thyroid hormones are secreted in the blood. They don't do anything in the blood. They have to enter the cells. In the cells, they go to an area of the cell where you make energy. It's the power plant. And they activate that power plant to convert the nutrients from the food and the oxygen you breathe into electrical energy, which then drives all the biochemical functions in the cells and makes your cells work and your organs work. What activates those power plants, which by the way are called mitochondria. Can you say that? Mitochondria? You probably remember it from biology. Those power plants are activated by thyroid hormone. So if you don't get enough thyroid hormone into your cells, then the energy production in your cells is low and your metabolism is low. What are the symptoms that people have when they have low metabolism, low energy production? Well, commonly fatigue, tiredness, maybe a difficulty with their weight, can't think clearly, low body temperature. Some people complain that they're cold all the time, cold hands or cold feet. Moods can be swinging or they can be depressed, panic attacks, anxiety attacks, joint and muscle aches and pains. Commonly, people with joint and muscle aches and pains go to see the doctor and he tells them they have fibromyalgia. Has anybody ever told you that? Fibromyalgia is not a diagnosis. It's a description of a symptom. It's a Latin term for joint and muscle aches and pains, for crying out loud. You tell the doctor, I've got joint and muscle aches and pains. He says you have fibromyalgia. He thinks he's made a diagnosis. A diagnosis tells you what the cause of the underlying problem is. What's causing my joint and muscle aches and pains? People with low thyroid can also have sluggish bowel function or irritable bowel function. They can have recurrent and chronic infections. Maybe they have a failure to thrive. Young kids that just don't do well and they're low on the growth curve and get recurrent and chronic infections. Commonly, these individuals have low thyroid within their cells. It also affects women's menstrual cycles, so that oftentimes women have irregular menstrual cycles when they're low thyroid. They oftentimes have an inability to conceive, so they're infertile, or if they do conceive, they miscarry. So a common cause of infertility and miscarriage is low thyroid. Now you go to your doctor with these symptoms and you say, Doc, could you check me for thyroid? He goes, why do you think I have low thyroid? Well, because I got all these symptoms. That doesn't mean you have low thyroid. We'll check that out, and I'll bet you don't. And sure enough, they do a blood test and they call you up, or Nurse Betty calls you up, or they don't call you and you have to call them, and you finally find out, I've got some good news for you. You don't have low thyroid. But doctor thinks that you might benefit from a little bit of Prozac or some other antidepressant. How can it be that you could have the symptoms of low thyroid and then not show up on your blood test? Because the blood test is a very poor and crude way to determine whether a person has low thyroid, low metabolism, or hypothyroidism, as the clinical term's known. So what happens? The lab determines the lab values. The last 1,000 people, they get an average, and then they add 2 standard deviations, which takes in 95% of the people. 95% of the time, you're going to fall within that range because the range is as tall as the Empire State Building, as wide as the Grand Canyon. You're going to fall within that range. If you fall out of the range, you're really sick. Our philosophy, my philosophy is this: if an individual has the classical features of hypothyroidism, low thyroid symptoms, give them a clinical trial of thyroid preparation. It's simple. It's just a little bitty capsule. You can get it in tablet form. There are several different forms of thyroid preparation. We use natural desiccated thyroid. I don't use any of the synthetic thyroid. Our experience is people on synthetic thyroid overall don't do well. They still have they still have the symptoms of low thyroid, but their blood's normal now. So if your blood normalized but your symptoms don't normalize, that tells you that the preparation you're taking to treat your thyroid problem is keeping your blood level normal, but it's not adequate to get in your cell. And that's the reason, because the synthetic thyroid is inactive thyroid. Now, here's my philosophy. You go to the doctor and the doctor says, oh, you got plenty of thyroid. It's like calling the waiter and saying, waiter, do you think I need a glass of water? He goes, oh no, you got water in your glass. But you want a full glass of water. You want to go around full of energy, not operating on just a quarter of a tank. So you want to fill up and get yourself up to an optimal level of thyroid, not a suboptimal level. If you have optimal levels of thyroid hormone in your cells, guess what? Your power plants are activated, your energy level is up, and when you have high energy, you have good health. My goal is to help you obtain and maintain health and wellness naturally so you enjoy a better quality of life. And I invite you to subscribe to my YouTube channel and follow me on Facebook. I'm Dr. Hotze, founder of the Hotze Health and Wellness Center in Houston. Look forward to seeing you next week.